Hey guys, so today's my 5th treatment. I'm a little sore from yesterday. We worked up in this area, but I'm feeling better and I'm looking forward to what's coming next.
All right, so 5th treatment of the day. We're going to focus a lot more on the hip structure today. We're going to dig in a lot into the glutes, around into the psoas, the hip flexor area, into the TFL. Probably travel down into the IT band. We're really going to focus on lower extremity today. You know what? You feel looser today.
Yeah, I definitely felt like that. Like I can tell usually right when I get up. And I think
that is, so she definitely, the tension in her spine is lessening. I definitely feel the muscles are looser.
Yeah. Like
that is really cool.
Yeah, I can tell that when I got up for sure. Because I can always tell in the morning.
Cool. All right. We're gonna try to mobilize a little bit of the sacrotuberous ligament, or at least take a little bit of tension off of it. The sacrotuberous ligament runs from an ischial tuberosity into the sacral area. So along this posterior oblique system, it's going to travel up this posterior line, go to the ischial tube, go through the sacrum, pass through that thoracolumbar fascia into the lat structure and onto the arm lines. So we're going to get into that sacrotuberous ligament. So this is similar to the boomstick, but I just use a little 15-pound club belt to put some consistent pressure on this trigger point. Saves my hands a lot of time, saves my my fingers from a lot of damage, and I'm able to get consistent pressure with little motion. Whenever you're doing trigger points, you want to try to keep a consistent pressure the best you can, and you want to try to minimize the vibration that your body might do as much as you can as well, because those proprioceptors in that area, you know, whether it be your proscenium corpuscles, whether it be your muscle spindle, any of your proprioceptors are going to feel that vibration, and it'll create a little bit of a contraction in that adhesion. So we want to try to minimize as much movement as we can.
When he puts that on my glute, it feels like it is just, there's like this pain, and then all these like nerves are just like out of control. Like I don't even know how to explain it. It's the weirdest sensation ever. Yeah, and then it's like I just can't even control the twitching. So I swear I'm not twerking on purpose.
There goes feet. So we know we hit the right spot. There it goes. So right now, you can just feel this. It's so tight right here. Super tight. Like the whole system's just tightening up. Go ahead and relax. There we go. But the whole system's tightening up. But what we did just before, when we treated here, it just eased it all. So we're just gonna wait. We're just gonna keep steady pressure. We're just gonna wait for the system to calm down.
I'm like trying so hard to relax.
Yeah, all you do is you just focus on your breathing. So we're going to use a little bit of NPS therapy along the paraspinals. We're going to hit some of the parasympathetics along through this area. It's going to hopefully it's going to be calming down a little bit. We'll hit a couple other points in the wrist that should help calm down her nervous system. Maybe try to drive a little bit of parasympathetic tone up and drive that sympathetic tone down. And so these little points sometimes are known as Prozac points. See how some feel like they're about to drill through you and the other ones don't?
Yeah, like that one you do before that one. Literally, like, oh my god. All right, so today we did a lot into the lower extremities, got into the glutes, into the hammies, really calmed down. Did a little bit of AMPS therapy, which is microcurrent point stimulation, through some of the calming points, just to ease off her sympathetic tone, try to increase her parasympathetic tone. And then we went into the exercise therapy, and again, kind of played with where to place this load to create an unwinding effect, almost an opposing winding effect to the scoliotic curve. Because as the scoliosis is trying to preferentially move her in a certain direction, we are trying to encourage the exact opposite, and we're trying to determine which loading parameters and which loading directions to basically unwind her. Okay, it's a long process, very encouraged. I think it's good. How do you feel about it? I feel great. I feel a lot less tense, and definitely like we've had some relief in my lower back area. So super excited about that, and I'm excited for what's to come.